Hi, it's Dr. Jon Perlman, certified by the American Board of Plastic Surgery and Beverly Hills plastic surgeon. A lot of patients come in and they would like to consider enlargement of their lips. Some patients obviously need it. Their lips are very flat. They've never had prominent lips. And others have nicely shaped lips but would like enhanced fullness. There are different options. Sometimes if patients are undergoing surgery and we're, let's say, doing liposuction or harvesting fat to use in the face, it makes sense to me to put fat grafts into the lips because the potential exists that the fat may last for several years. But for most patients who just come in for an office visit, the option is limited to injection of fillers such as Juvederm or Restylane. I happen to use Juvederm and I think they're relatively equivalent, but either is probably equally good. We don't put Radiesse in the lips because it tends to get bumpy. We don't use Sculptra in the lips, but hyaluronic acid fillers such as Juvederm Ultra or Ultra Plus are good options. Ultra Plus is generally felt to be a little more firm than the Ultra, so most doctors tend not to use it in the lips, but it's not unheard of to be used that way. Doing lips properly requires an aesthetic sense of a pretty lip and a good balance between the upper and lower lips. The lower lip should generally be more prominent than the upper. There should be more prominence in the central area, with two prominences, one on each side of the midline, being a natural shape. In the upper lip, we also have the choice of how we inject it, whether we inject it primarily along the junction line between the pink part of the lip and the skin, or into the pulp portion of the lip. And most of us favor injecting the pulp with a little highlighting of that gray line at the junction of the pink and the skin. Too much in that area looks unnatural. Too much evenly placed across the entire lip tends to look, I think, strange and unnatural looking as well. So being careful not to overdo it and to inject it properly is important to get a rewarding, natural, good look. You want people to wonder if you're lucky, or perhaps if you've had your lips injected, you don't want them to know immediately that your lips have been injected. It just doesn't look good, and it's not a goal that I seek in my practice. And in terms of volume, it's very rare that I'll inject more than one syringe into a patient's lips. Even if they have almost nothing, I'd rather inject a syringe, let them wait a couple of weeks or a month to see how it looks, and then consider the option of injection of small quantities of additional filler. But 2 syringes or more, I think, unfortunately, most of the time does look unnatural. It sometimes looks bizarre. And I know a few people like that look, but I don't like them walking around with that look if I'm responsible for it. I hope that answers your questions. I hope you have a good day. Thank you for your time, and thank you for listening.